White and red ginseng are two different post-harvest forms of Panax Ginseng. While the white ginseng is natural raw ginseng root that's been dried and peeled, the red ginseng is the root that's been steamed before it's dried and peeled. The white and the red ginseng don't just differ in colour and the way they're created. The production process that they undergo gives them varying compositions and different concentrations of beneficial compounds. According to Chanwan Chow et al., the fresh ginseng contains carbohydrates, minerals, compounds with nitrogen, and around 30 different ginsenosides, which are the active pharmacological components of the ginseng. According to research, when the fresh Korean ginseng undergoes the steaming process before drying, it produces new components in the red ginseng. These new components include arginine fructose glucose and ginsenoside RH1, RG2, and RG3. Because of these additional components, the Korean red ginseng is said to provide more health benefits than the Korean white ginseng. For instance, it's found the non-saponins that include the arginine fructose glucose may have the capacity to regulate diseases that result from the activation of the AAM2 inflammasome. These include cardiovascular, skin, and chronic kidney diseases. It was also concluded the ginsenoside RH1 might be used as a treatment for colorectal cancer, after it was found it markedly decreased both the volume and the weight of a tumour in SW620 cells in a dose-dependent manner. Meanwhile, the RG2, according to one study, might prove effective in the treatment of type 2 diabetes because of its proven ability to improve insulin resistance. It was concluded the RG3 might possess neuroprotective properties. This was found after using a hippocampal neural model, where the ginsenoside inhibited an increase in calcium levels associated with epilepsy and seizures. Though the health benefits of the two process forms overlap, with one typically being more efficient and efficacious than the other, the better choice for a person seeking health benefits depends on the benefits that they seek. One study found Korean ginseng in general reduces fatigue in patients with idiopathic chronic fatigue. The researchers came to this conclusion after lower reactive oxygen species and melandehyde levels were reduced in patients who were administered 1 to 2 grams per day of Korean ginseng extract for 4 weeks. According to the meta-analysis of the peer-reviewed scientific studies on the reactive oxygen species, the reactive oxygen species have been found to be a direct cause of fatigue. The melandehyde, meanwhile, like the reactive oxygen species, is an oxidative stress marker, and a study found the oxidative stress contributes to the idiopathic chronic fatigue. Of the two forms, Korean red ginseng gives more energy than the Korean white ginseng. Although there's not been a comparative study between the red ginseng and the white ginseng in this regard, many of the researchers who've proven the effects of the ginseng on fatigue use the Korean ginseng in its steamed and dried form to prove their hypothesis. For instance, one study concluded the Korean red ginseng has a potent anti-fatigue effect. In this group of 174 Chinese study participants, they were given 1.8 to 3.6 grams of the herb for 4 weeks. The researchers came to the conclusion following an improvement in the subject's traditional Chinese medicine symptom score, and their scores based on their own fatigue assessment. The researchers said these effects are also dose and time dependent. Another study concluded while the Korean red ginseng doesn't show absolute anti-fatigue effect, it had a therapeutic potential for middle-aged people with moderate fatigue. This was after the researchers found the fatigue visual analog scale results went down for the groups who participated in the study. There was given 3 grams of Korean red ginseng. This was assessed after following up 1 month after the 6 weeks of treatment. The decrease in the fatigue in those over the age of 50 was found to be more significant. Both studies focused on the effects of the Korean red ginseng on fatigue, but didn't delve into the specific components of the process form that gives it its anti-fatigue property. It was hypothesized it might be its ginsenoside and acidic polysaccharide content. An overview of Korean red ginseng shows it has proven antioxidant activity, and this might be also responsible for its anti-fatigue effects. While the research is clear on the anti-fatigue effects of the Korean red ginseng when compared to white ginseng, further research is still needed to determine which particular component of the red ginseng is responsible for these effects. The Korean red and the white ginseng have been shown to enhance cognitive function. One study found the intake of the Korean ginseng, whether white or red, for more than 5 years can have positive effects on cognitive function in the elderly. It made the conclusion after finding the Consortium to establish a registry for Alzheimer's disease, or the CRAD test scores of the elderly Koreans, who used ginseng for more than 5 years, had higher scores than those who didn't take it. However, the researchers stated there was no noted difference in the change in the scores when a follow-up was made after just 2 to 4 years of ginseng use by the test subjects. Red ginseng is considered better at ensuring sharper cognitive function than the white ginseng. When the effects were compared of the white ginseng extract to the red ginseng on the brain using ischemic stroke mouse model, both the red and the white ginseng exhibited neuroprotective effects. Pre-treatment of 1,000 mg per kg body weight of the red ginseng extract led to a reduction in the brain area affected by edema, which results after an acute ischemic stroke. It also led to a reduction in the total infarction volume, a measure of the resulting clinical consequences of an ischemic stroke. The researchers concluded, since these events were not observed in subjects that underwent the pre-treatment with the white ginseng, the red ginseng extract is more efficacious than the white ginseng when it comes to brain protection. The same researchers concluded the ginsenoside RG1, which had already been proven to exhibit neuroprotective effects prior to conducting their study, was, however, not the component that was responsible for the red ginseng's potent protective effects on the brain. They arrived at their final statement after noting that the white ginseng has 3 times more the content of this ginsenoside than the red ginseng, and they concluded the neuroprotective effects of the red ginseng were derived from its ability to suppress the changes in the cells that are associated with inflammatory responses to an ischemic stroke. These responses can in turn result in adverse effects on the brain. The researchers also noted red ginseng's neuroprotective effect was associated with its capacity to inhibit the activation of the programmed cell death pathways. The researchers didn't specify which specific component enabled the red ginseng to trigger these events. Korean ginseng in general has been proven to exhibit anti-inflammatory activities, and this makes it ideal for the treatment of diseases caused by inflammation like gastritis and arthritis. A study found that the anti-inflammatory effects of the Korean wild ginseng could be enhanced with fermentation using a probiotic bacterium. One study also found even less studied calyx of the Korean ginseng exhibits anti-inflammatory properties, and this is found in the berries. Of the 2 processed Korean ginseng forms, it seems the Korean red ginseng is better for treating inflammation than the white. Comparative studies on the anti-inflammatory effects of each type are limited. However, one study observed the efficacy of the red and the white ginseng in the treatment of asthma. It found while both forms exhibited anti-asthmatic properties, the red ginseng was more efficacious than the white. In this study, the components of the ginseng inhibited the production of inflammatory cytokines by the peribronchial lymphocytes, and they allowed for reduced infiltration of the inflammatory cells into the bronchoalveolar areas of mice with asthma. Again, the study didn't state which specific component of the red ginseng gave it its potent anti-asthmatic effect, adding further studies would be needed to identify it. One study concluded RG3 in Korean red ginseng might be responsible for anti-inflammatory effects. They came to this conclusion after they found a remarkable attenuation of inflammation in mice with septic shock after being administered the RG3 enhanced red ginseng. The same results were observed in their in vitro study. A separate study said the ginsenoside RC in the Korean red ginseng might be responsible for the anti-inflammatory effects, based on in vivo and in vitro mouse studies. Korean red ginseng can also increase the blood circulation. In a meta-analysis of studies on the Korean ginseng and its potential for the treatment of cardiovascular disease, researchers concluded the ginsenosides in the herb give it these properties. The red ginseng seems to be more effective for improving the blood circulation than the white ginseng. Studies on white ginseng's effect on blood circulation are very limited. While numerous studies have proven the Korean red ginseng's positive effect, In fact, most, if not all, of the researchers who affirm Korean ginseng's potential for the blood circulation enhancement use the Korean red ginseng and not the Korean white ginseng as the subject in their studies. For instance, they found participants who were given 1.5 grams of Korean red ginseng for 8 weeks showed a decreased imbalance in the thermal distribution according to digital infrared thermal imaging. This, the researchers said, suggests that Korean red ginseng causes an enhanced distribution of blood in the body. Another study found Korean red ginseng extract enhanced blood circulation in healthy humans, whether administered in small doses or high doses. The study stated it does this by inhibiting the platelet aggregation. The studies didn't specify which component of the red ginseng yielded the positive effects on the blood circulation. However, one study said the ginsenoside RG3 in particular, dehydroginsenoside RG3, a chemical derivative in the Korean red ginseng, potentially inhibits platelet aggregation. Ginseng has been used as a treatment for diabetes due to its blood sugar lowering benefits. A meta-analysis of the studies showed that the ginseng has an effect on animals, cells and humans, and it concluded these effects were particularly pronounced in type 2 diabetes patients, but not in healthy or pre-diabetic individuals. The red ginseng is better for lowering the blood sugar than the white ginseng. One study concluded the glycemic parameters and the blood pressure levels in individuals with type 2 diabetes who were administered 3 grams of Korean white ginseng and were given 50 grams of glucose load during 5 times that they visited the researchers were largely unaffected. The researchers found that there was modest but significant reductions in the hardening of the arteries. Additionally, multiple other studies have confirmed the red ginseng's anti-diabetic effect. One study, for example, found that patients with newly diagnosed type 2 diabetes had lower serum and whole blood glucose levels when they were administered 5 grams of Korean red ginseng for 3 months. A separate study found 2 grams of Korean red ginseng roots were enough to reduce the postprandial glycemia, or the increase in blood sugar levels in the body after a meal. The study noted that further studies on the long-term sustainability of this strategy are still required. Again, neither of these studies specified which particular component in the red ginseng allowed for the blood sugar lowering effects. It was hypothesized based on the meta-analysis of existing studies. The smaller ginsenosides, RG3 and RH1, were responsible for the anti-diabetic effects. Ginseng is considered relatively safe if it's consumed in small doses. Side effects, however, have still been reported. For instance, it was found morning diarrhea, skin rash, nervousness, and difficulty sleeping were common side effects caused by the consumption of ginseng in a 2-year study. The most serious side effect reported was low blood pressure, although this was a rare occurrence. White ginseng is less likely to produce side effects than the red ginseng. Studies on the severe side effects of the white ginseng in particular are scarce, while studies on severe side effects due to the consumption of red ginseng are plentiful. A study noted an occurrence of gynecomastia, or breast tissue enlargement, in a 12-year-old boy who'd been taking Korean red ginseng extract for 1 month to enhance his athletic performance. The study didn't mention the exact dosage consumed though. Meanwhile, a meta-analysis on the studies of the side effects of ginseng abuse found a manic episode in a 26-year-old woman who had no history of psychiatric illness after consuming the Chinese red ginseng capsules for 2 months. A safety analysis of Panax Ginseng also noted anal bleeding and eczema, among others, in patients aged 40 to 70, and administered the Korean red ginseng extract powder of 0.8 grams daily for 8 weeks. The fact the red ginseng yields more severe side effects than the white ginseng might have to do with the fact that the form has been proven to yield more potent health effects than its counterpart, as the steaming process involved creates the post-processing form and significantly increases its biological activity. In particular, if subjected to steaming for 3 hours at 120 degrees Celsius, the antioxidants in the red ginseng are multiplied 8 times. The resulting red ginseng can therefore improve the blood vessel relaxation by up to 32 times. Since the health benefits of the red ginseng are more potent, it might be logical to assume the same potency can carry over and manifest as stronger side effects in some patients who consume this form. Ginseng was used as an aphrodisiac in ancient Chinese medicine. It was utilized primarily to treat erectile dysfunction and to improve sexual behavior. Although the conclusion that the ginseng yields positive effect on the sexual function was merely based on anecdotes at the time, contemporary research has proven ginseng indeed has an effect on sexual performance. One study found male rats given the red ginseng ejaculated earlier and did so more frequently than those not given the herb. They were also found to deposit more copulatory semen during a 10-day observation period than the rats that did not consume the ginseng. The study didn't mention the exact dose or the form of the ginseng that the rats were given. The red ginseng is considered better than the white ginseng for boosting libido. Most of the studies that have proven the positive effects of the ginseng on libido have used the red ginseng in their experiments. One study produced findings that the copulatory disorder in male mice who were housed for 5 weeks improved after being administered the red ginseng components. One study meanwhile found that menopausal women who took 3 Korean red ginseng capsules per day, with 1 gram in each capsule, scored higher in the Female Sexual Function Index and in the Global Assessment Questionnaire. The study didn't specify how long the Korean red ginseng treatment lasted, but the researchers concluded, based on the scores, the Korean red ginseng might be used to improve the sex life of menopausal women. Although they didn't specify which component in the red ginseng enhances the sexual arousal, it was concluded the ginsenoside RG1 and the crude saponins might be responsible for the effects. The researchers made the conclusion after they observed that the house mice who were given ginsenoside RB1, R0, and RB2 didn't engage frequently in the copulatory behavior, but they did so when they were administered the ginsenoside RG1 at a 2.5, 5, and 10 mg per kg concentration. They found the same results with the mice administered the crude red ginseng saponins at 25, 50, and 100 mg per kg body weight. To learn more about herbs, supplements, natural treatments, or to book a consultation, check out my website.